Hey, everybody. Welcome back to another episode of Caregiving Insights. I'm here with DeLon Canterbury, who I'm excited to talk with today. And in part, I'll learn more, but you folks will all learn a lot more. DeLon has a very unique background, and he is working towards deprescribing drugs and specifically focused on the senior population. And that speaks to me because my mom is on countless medications and there are many of other people, and I'm going to let him talk about the specifics. So welcome, DeLon. Thanks for being with us.
For sure, Todd. Appreciate you having me on. How you been doing?
I'm doing great. I'm doing great. Can't believe it's almost the end of 2022. And
Oh man, I tell you, it's blowing by. Excited to be here.
let's jump right in. You know, your background as a pharmacist, I'd love for you to share with us, how that came to be, what led you to that, and where you did your studies.
Yeah, I'd love to. So my parents originated from South America and Guyana. And so my mom was really big on understanding what natural plants were in her backyard, not just for survival, but also for healing and remedies. And so she would brew all types of teas and bitters and basically treatments that can help with the cold or allergies or asthma. You name it, my mom would come up with something. And that was a part of her cultural upbringing. And it really brought on to her three kids when we were growing up in the US. So that really opened my eyes to the world of healing and like how do we use natural medicine and what's the science behind getting people better, right? That got me into the world of pharmacy, and it got me to the world of just really getting a good idea of what the drugs are doing and understanding how to better help my community. Fast forward to today, I honestly developed a passion for geriatric pharmacy and working in the retail setting. I used to be a pharmacy manager with Walgreens. I ended up stepping down and creating my own company, GeriatRx, to focus on specifically using my medication knowledge to advocate for, well, caregivers and patients and seniors on way too many meds. It came from really having my grandmother who suffered from mild dementia, who was inappropriately prescribed an antipsychotic medication while she was in an assisted living facility. And what was a simple mild dementia diagnosis turned into an extremely severe one. She became very irritable. She was sundowning. She was angry. It got to a point where her behavioral symptoms just could not be managed. So parents had to move her from Brooklyn down to Atlanta, and we were able to see firsthand how she was just not aging well in place. So it really wasn't until a pharmacist in the community noticed that the medication was causing the issue. And that was something that lit a fire in me, and just seeing how we had to struggle for what months trying to navigate her care and basically have two full-time parents figure this out. And I wasn't quite a pharmacist yet, but it showed me that there are tons of people potentially falling through the cracks and not catching some harmful medication errors. So that struck a chord with me, and she's been the impetus behind using my voice and education to advocate for seniors in need.
So part of your education is geriatric pharmacotherapy, if I have that correct. Tell
Yeah,
me how
that's
that
right.
differs from the just your previous education in pharmacy.
Yeah, good question. So in pharmacy school, you kind of get the 4 years of general basic clinical skills to practice as a pharmacist. And just like medicine, there are different specialties pharmacists can get into, like oncology or diabetes or heart disease, whichever. I chose geriatric care, and that's a credential you get after you finish school. So some people can do a residency and get that same type of experience, or some people can just take a test and get a credential that's board certified from our Board of Pharmacy Specialties, and they designate that credential for you. I opted to choose the latter and take a test, and I still work with seniors, of course, but that passing that test ensured I was aware of, understanding advanced directives, understanding social barriers to care, understanding transitions of life care, getting a full lens that you don't necessarily get in school. You're frankly barely getting a lot of geriatric care in school. So that specialty gave me that extra attention and detail to the body as we age, how drugs respond, how there's really a completely different way of responding, and how side effects are more pronounced in people that are older. They're just more sensitive to the drugs.
Yeah, that's really fascinating. It's an important distinction for people to understand, especially when you're talking with folks and you're talking with doctors who are prescribing medications. They may be prescribing an ACE inhibitor for a 30-something-year-old, but they may be prescribing it for a 75-year-old, and there's different considerations to take into account. So let's talk about the traditional process. Then we're going to get into a little bit more detail. So the traditional process, how do prescriptions get filled? What's that process?
Yeah, sure. So generally, a patient is going into a medical office, or at least in these days, there's a telehealth consult or something, but you're seeing a provider who has prescribing authority, and they look at your symptoms and try to come up with a disease, and they basically are taught to treat the disease. And so in doing so, uh, clinicians, whether they be PAs, NPs, or just general doctors, they have the right to write within their realm of doing no harm to help you, the patient, right? So, unfortunately, a lot of times in this process, pharmacists aren't really consulted. It's kind of just written and sent to a pharmacy where eventually your prescription gets filled and you choose to pick it up or not. So, believe it or not, really about maybe 60% of all prescriptions sent are actually filled. To be actually filled, maybe only half of people actually pick up the medicine. So even though you see that doctor, there are huge barriers that come once you leave that office in that process flow. So after all that lack of really consulting with a pharmacist, and I'll get to that later, the script is sent to a pharmacy, then you have a pharmacist look at the script and assess whether it's safe and effective based on, the patient's summary or notes, or essentially if it's just, within the right dose for this specific patient. Now, after that, it's kind of just the pharmacy fills it, it's ready, we bill your insurance, and the patient chooses to pick it up or not. And that's how you get, 2,000 pickup calls from Walgreens to pick up your meds. So generally, that's the process. But where I kind of see the cracks in our process is we're not consulting the drug experts until it's literally the last line of defense, so to speak, before the patient actually takes it. And if we're running into issues, for instance, it could be a prior authorization, or the drug could cost too much, or it may lead to a severe reaction, or maybe there was a medicine on file that the prescriber wasn't aware of, but the pharmacist is, and now I have to call as a pharmacist to say, hey, were you aware that they've gotten this already? And it led to allergic reaction, something. So that's kind of the issue with this process, is that our system is so fragmented. Pharmacists generally aren't going to know all of your labs. They're not going to know all of your medical health records. They're going to just know your basic medication profile. And if anything, they could maybe look up what controlled substances you may take. But other than that, there really isn't any EHR in a pharmacy. So you're basically using the drug knowledge to see if it's appropriate. So to me, that's where I think there's an opportunity for pharmacists to integrate more into offices to avoid unnecessary harm before we write those scripts and before it's actually filled and goes to the patient. There are differences. Not everyone is has a specific credential as a pharmacist. I'm a geriatric trained one. Most of your community pharmacists are community pharmacists. Doesn't mean they can't help seniors, doesn't mean, they can't help people with oncology or needs, or diabetic needs. It just means it's more general, where we are trained in geriatrics to be specifically tailored to this population.
Interesting. So you've gotten into a lot of detail there, which is great, because that's going to set up really why we're sitting here today, which is you've created this very interesting company called GeriatRx, or you may call it geriatrics. I'll ask, how do you pronounce that correctly?
Yeah, geriatrics.
It's great. It's a great name. So I think the audience has a kind of an idea of why you've created that. So tell us a little bit more about that and what it does.
Yeah, so we are a telehealth company. We provide concierge pharmacist services to anyone in the country. Essentially, we are your medication advocate and expert as you are navigating this healthcare landscape. So if you're worried about a loved one who may be on too many meds, or if you yourself are just tired of taking too many meds, we give an objective opinion on what you could potentially do to get yourself safely off of prescriptions. And the way we do it is that we work with your provider. We come up with a plan that's patient centered, it aligns with your goals. We personalize it, we give you the full attention. You know, people are seeing a doctor for 15 minutes, 20 minutes. We talk to our patients for at least on average an hour and 15 minutes per visit. And the whole goal is to be thorough, it's to be educational. It's to give you the tools to empower yourself and to assess needs you may need in navigating this. So, with that being said, yeah, we work with patients on retainer contracts and serve as advocates, whether we are maybe sitting in on a medical office, doing a comprehensive med review with you, the patient, coming up with potential strategies with the provider to get you off of pills, coming up with a pharmacogenetic or a genetic test to see if your genetic testing can result in a better use of meds that won't cause harm. We're doing concierge services that I feel our healthcare system's lacking. And so we're giving peace of mind to people without being attached to a pharmacy trying to upsell you on getting your things filled, or an insurer who doesn't want you on this drug but wants you on another. We're here about straight objective facts, and with our expertise and drug knowledge, that's how we're able to advocate for caregivers and patients who are just dealing with really not having any success with being on 20 meds at a time.
Do you have instances where, well, it's a twofold question. How do you work with doctors in this? Because, I, knowing my mom and many other folks, they'll want your thoughts, but they also may be hesitant because they're going to say, wait, my doctor, I want my doctor to be on board with this. How do you bridge that conundrum, so to speak?
I love it. Yeah. So I try to be very upfront with my approach and emphasize that, providers really just want what's best for their patients. And sometimes they simply don't have the time of day to give that level of attention when it comes to the medicines. And so the truth of the matter is this: our doctors are brilliant. They're doing a lot in our health system, but they're overburdened. And not to call out necessarily, a potential red flag, but medical doctors aren't exactly trained the way pharmacists are trained when it comes to drug knowledge and expertise. They may get just a couple of weeks of pharmacology, and yet there are guardians behind who gets what when it comes to prescriptions. Whereas pharmacists literally have 4 years of drug expert knowledge. And so sometimes that can fall waste if we're not being used, I feel, to the top of our license. Well, in terms of what we do, we come straight from the olive branch angle and just say, hey, we are hired by your patient to provide extra support for you, the doctor. We're looking at the same patient. We're here to reduce your time and headache by preventing any unnecessary errors that you would have to waste a clinic visit with. We're reducing your wasted resources and labor force so that you can help other people, because you're not just helping someone who's been unmanaged for 2 years with diabetes, because we were able to talk through that adherence problem or whatever the issue maybe. And so we're coming from the angle of simply solving the provider's problem of time and really the lack of capacity to do all the things they want to do. And so we're just doing the work with them. And so it looks like we end up getting to a point where we're either, texting doctors in real time of concerns about a patient, or we're just doing follow-ups and checkups with the providers team. So it really is a holistic team-based approach we're providing to care.
Yeah, I was going to say that it sounds like more than what to an extent. I mean, I know the pharmacists locally here who we go and get whatever's needed for my parents, and they're great. And there's two on staff. It's a CVS, and
Mhm.
they're really helpful. What you're doing sounds more team oriented, where you become more integrated in the process before it lands on the desk of the actual filling pharmacy. Does that sound correct?
Oh yeah, we don't really do much with the pharmacy. Our job is to make the pharmacy's lives honestly easier. If we can get people off of pills, we'll try to have them close those scripts so they don't get refilled again, especially once the doctor has buy-in and agrees that we can safely stop that medication. So yeah, we're all about rolling out the team-based approach and making sure we're aligning it with the patient's personal goals.
It's really great to hear because we know how sometimes that can be a challenge, and you have to triangulate between the patient and the doctor. So there's that sensitive, could be a sensitive area at times depending on the doctor and the patient. So
For sure.
yeah, so this is all really great to know. And I also understand that you do a coaching program for pharmacists, nurses, and doctors. Can you tell me a bit about that?
Yeah, I would love to. So, yeah, you're referring to our prescribing accelerator. We have a year-long access 12-week coaching program that is going to teach clinicians who are passionate about prescribing and looking to integrate a new business model into their senior care business. And so we focus on training doctors, clinicians, pharmacists, nurses, as well as social workers who have a passion for senior care and are looking to advocate against harmful medication use. In our 3-month program, we're essentially giving people the tools to not only get the clinical pieces of prescribing with up-to-date evidence-based recommendations, easy to use clinical tools, easy clinical tools and clinical skills and assessments. But you're also getting the business side of, okay, how do we package what type of prescribing you want to do? Do you want to focus on stopping opioid use? How can we use prescribing there? Do you have a passion for dementia? Do you want to help with avoiding dementia medicines that worsen dementia? That's how we're using prescribing and showing that there's a versatile role we all have. And I think prescribing needs to be really brought on by both the caregiver and the provider, right? I think it's easier for the provider to do it, but generally what happens is the caregiver is like, hey, I'm worried about mom taking too many meds. What can we do? And that is honestly in itself a prescribing conversation. So we're just giving people the tools to bridge the two and develop a model service that they can use to better support their community.
Yeah, it's wonderful. It's really incredible what you are doing here. And so to bring it back around, what are the ultimate goals of geriatrics?
Absolutely. My biggest goal is to have an international prescribing company. Now, prescribing is kind of an optional topic in the world of geriatrics, but I want a company that is in every state, having a task force of social workers, pharmacists, nurses, chiropractors, interdisciplinary, as you can tell, integrative medicine health enthusiasts, people who like to use movement and food as medicine. I want people who are using holistic approaches to care with evidence science backing it up. And so my goal is to literally fund and mobilize this movement in unnecessary prescription use. And if we can stop it, there's no need for a 90-year-old woman to be on 30 meds, period. Like there just isn't any science to that. So my job is to accelerate prescribing, not just from the clinician end, but how do we empower our providers, I'm sorry, our patients and our caregivers who are worried about this and really are tired of paying too much at the pharmacy counter for something that's not helping. So for me, it's embedding this train of thought into schools of pharmacy, schools of medicine, schools of nursing. It's changing the future mindset of future prescribers on how we should really use our medications a bit more. a bit more safely.
So is there anything that we've missed?
Well, for me, one of the game changers in my business was informing patients about genetic testing. It's definitely not going to be it'll catch everything that's wrong with you type of situation, but a new world of pharmacy and healthcare is precision medicine. And so getting people pharmacogenomics or the study of genes test and drugs can really shed some light on maybe why people aren't responding to those antidepressants, or maybe why they're not responding to that opioid that they're using for pain management, which I generally would want to avoid anyway. But the truth is, genetic testing is one of my favorite topics. One, I think it does bridge a bit of some of the health equity gaps. Basically, those of low income may not have access to this type of test. And this can give you an idea of, hey, based on your genes, your liver, your whatever, I can tell that you would be a poor responder to this medicine, or you have a likelihood of having, it could be, ApoE if we're talking about dementia, or you could have less serotonin in other people. So you may need a higher dose for an antidepressant, whatever the case is. Those are kind of examples of how this can be used. And I mean, I'm seeing it find rare blood clotting disorders. I'm seeing it tell me that certain patients would need almost double the dose if they were to get a liver transplant or kidney transplant. So the utility is honestly lifelong and vast. So I love educating people on the power of pharmacogenomics or genetic testing and getting their drugs assessed.
Let me ask you a follow-up question to that, because I'm not sure, and I'm sure many of the audiences don't. How does somebody go about getting genetic testing?
Yeah, first and easiest thing is to, ask your provider, see if you're eligible. Not every medication you take is going to have a genetic, component to it. Some do. And if you do have one and you're finding yourself either, failing therapies or not doing well on them, it may be worth a shot to see, particularly if you're dealing with cancer or opioids, or antidepressants, or even cardiovascular drugs like Plavix can have a role in genomics. So asking your doctor is number one. Number two, there are tons of labs you can consider using online that sell directly to consumers. And you could pop in your insurance number and they could potentially bill straight from the facility and send it to you. Or, of course, you can choose your trusty genetic testing expert like myself, or even local genetic counselors. They're able to order that test for you as well. But you got to make sure, to understand that some of them don't always have pharmacists, which are legally allowed to counsel around the meds as well as the genetic test, whereas some will just be able to tell you about, here's your report. I can't tell you what that means with the drugs, but I can tell you what this means for what we have today.
Well, this has all been very enlightening. I, to me, I learned even more than when we spoke last week, and I'm sure the folks watching it have also learned a lot. So thank you so much. I really appreciate you taking the time, and wish you all the best with GeriatRx. That's near and dear to me, and near and dear to probably most of the folks who are choosing to watch this episode. And so thank you again.
Absolutely. Appreciate you having me, Todd. Have a great weekend. Thanks for having me.
Absolutely. Take care. The primary purpose of the podcast is to educate. While guests are invited to listen, listeners acknowledge that they are not being provided professional advice from the podcast or any guests. One Day, One Week and its sponsor, 17 Commerce LLC, expressly disclaim any and all liability or responsibility for any direct, indirect, incidental, special, consequential, or other damages arising out of any individual's use of, reference to, reliance on, or inability to use the podcast episodes or the information presented in the episodes.